Cerebral palsy (CP) is a group of permanent movement disorders that appear in early childhood. It is caused by abnormal brain development or damage to the developing brain, often before birth, that affects the person's ability to control their muscles. Types of cerebral palsy. Cerebral palsy is classified based on the type and location of movement difficulties. Spastic cerebral palsy. This is the most common type, characterized by stiff muscles and exaggerated reflexes. It can affect one side of the body, hemiplegia, the legs, diplegia, or the whole body, quadriplegia. Dyskinetic cerebral palsy involves problems controlling the movement of hands, arms, feet, and legs, making it difficult to sit and walk. It includes dystonia, twisting movements, and choreoathetosis, slow, writing movements. Ataxic cerebral palsy, characterized by a lack of coordination and balance, leading to shaky movements or tremors. Fine motor skills like writing or buttoning the shirt are often affected. Mixed cerebral palsy, a combination of symptoms from more than one type of CP. Symptoms. The symptoms of cerebral palsy can vary widely. Motor impairments, difficulty with movement and posture, such as stiffness, floppy movements, or involuntary movements. Muscle tone abnormalities, either increased tone hypertonia causing stiffness or decreased tone hypotonia resulting in floppiness. Coordination issues, trouble with balance, coordination, and fine motor skills. Delayed milestones. Children with CP might be slow to reach developmental milestones like sitting, crawling, or walking. Speech difficulties. Trouble with speech, including slow or slurred speech dysarthria. Cognitive impairments. In some cases, intellectual disabilities or learning difficulties. Seizures. Some children with CP have epilepsy. Other problems. Vision or hearing impairments, spinal deformities, joint problems, or difficulties swallowing. Dysphagia. Causes. Cerebral palsy is caused by abnormal brain development or damage to the brain. Prenatal factors. Infections during pregnancy, e.g., rubella, cytomegalovirus exposure to toxins, or problems with blood supply to the developing brain. Perinatal factors. Complications during birth, such as asphyxia, lack of oxygen, premature birth, or low birth weight. Postnatal factors. Infections like meningitis, head injuries, or stroke in infancy. Diagnosis. Diagnosis of cerebral palsy typically involves developmental monitoring, observing a child's growth and development over time. Developmental screening, tests to identify delays in movement, posture, or muscle tone. Neuroimaging, MRI or CT scans to identify brain abnormalities. Genetic testing, sometimes performed to rule out other conditions. Treatment. While there is no cure for cerebral palsy, treatment can improve quality of life. Physical therapy helps improve muscle strength, coordination, and mobility. Occupational therapy focuses on improving daily living skills. Speech therapy assists with communication and swallowing difficulties. Medications to manage muscle spasticity, seizures, or other associated conditions. Surgical interventions. In some cases, surgery may be needed to correct physical deformities or reduce spasticity. Assistive devices, braces, wheelchairs, and communication devices can aid mobility and communication. Prognosis: the severity of cerebral palsy varies, and so does the outlook for each person. Many individuals with CP live fulfilling lives, particularly with early intervention and proper care. The condition does not worsen over time, though symptoms may change with age. Support and management: family support. Parents and caregivers need education and emotional support. Educational support: children with CP may need special education services. Social and emotional support: counseling and support groups can be helpful for the individual and family. Cerebral palsy requires a comprehensive, multidisciplinary approach to management, with an emphasis on maximizing the individual's independence and quality of life.